Steve Bryan.
Thank you very much, Mr. Deputy Speaker. Here we are again, and this time, 2 weeks on, I think the concept of learn to live with COVID is as dead as anything I know. We were told in July, in this House, from that box, many, many times, and from the podium in number 10, that we are on an irreversible roadmap to freedom. Do we all remember that? I have to say, I thought it was an unwise hostage to fortune when it was said, and so it has proved. Now, when I vote here tonight, I'm going to consider the legislation before us, and I completely agree with the previous speaker. It should have been published long before, less than 24 hours before the debate, and that's why I certainly didn't tell anybody in the media how I was going to vote today, because I'm rather old-fashioned and like to actually read the legislation that's before me before I decide how I'm going to vote. I wish the official opposition front bench had done the same. But I look at the legislation, I also look at the intention behind it. So what's the intention here? Is it to stop Omicron? Is it to slow the spread? Well, that's clearly not happening now, so I guess the question that we've got to ask then is, are these 4 SIs before us going to do that? Now, working from home is not an SI, it is guidance. We're told that people need to work from home where they can, but they can then meet those very same people in the pub that evening, every evening. Is that going to slow the spread? I don't think so. Now, when it comes to masks, I abstained on the mask SI 2 weeks ago, and I will do so again this evening. I have no issue with wearing a mask. It doesn't impact on my life. It doesn't impact on my freedoms. Many of my constituents have been wearing masks in plenty of situations, indoors and out, for a long time throughout the pandemic. I think it's a bit of a crutch, but if people believe that it makes them safer, then that is fine, and I guess in many ways it is an instrument of people feeling they're safe. But looking at the SI that's before us on mask wearing, Mr Deputy Speaker, we have to wear a mask covering in certain shops, but not in pubs, not in restaurants, and some of the exemptions in there, I think, make a mockery of it, but I won't stand in its way. And then on the COVID passport, I mean, if you were to put aside the practicalities and the moral arguments, which I do not, and many of my constituents writing to me certainly do not, then a vaccine doesn't stop you getting this. It doesn't stop you passing it on. Professor Whitty said to MPs on a call this lunchtime that there is a minimal impact on transmission of all of our vaccines. So look, last Wednesday, when the Secretary of State stood there and made his late-night statement, I expected it to be, because that statement came earlier than we expected, I expected him to bring forward a devastating piece of science which basically said the drugs don't work. That isn't what he said. He said we're moving to Plan B based on the basis of some modelling. Yet we have SAGE's gloomy predictions and a confirmation that vaccines do work with 2 jabs, even better with a booster. Completely agree. Today we have a study that says the Pfizer vaccine has 70% efficacy against the Omicron variant. Last Wednesday's statement to the House, Mr Deputy Speaker, in my opinion, should have been about the national booster effort that was announced on the live TV broadcast on Sunday night. I can't say how many of my constituents have contacted me furious at the frightening nature of that broadcast and sent their children off to bed terrified. If we truly mean this learn to live with COVID mantra that we hear and continue to hear, the booster campaign is 100% where our focus would be. And an ongoing plan to keep immunity high is what we should be focusing on. And this is where I just want to focus my remarks, is that a new primary care infrastructure is probably what we need, because panic stations and cancel all else is not a plan, Mr Deputy Speaker. I spoke to 3 of the 4 primary care networks that cover my constituency yesterday. They're going to do their absolute everything to offer it to all eligible over 18s by the end of this month, but it's going to be really difficult. They're scrabbling around for venues in the week of Christmas. I just don't think this is the long-term thinking that we need. On the actual regulations, so 1,400 on face coverings, I'm ambivalent to that. I won't stand in its way. On isolation moving to test, I will support that if there's a division. I don't suspect there will be. But if you can't get the lateral flow tests, as you haven't been able to today and yesterday, as I raised in my intervention with the Secretary of State, then we get the pandemic anyway. So we need to sort that supply out. On the vaccine passport, I will not support that. I think it crosses a Rubicon. I think Italy began in exactly this way, saying it was all about providing lateral flow tests, and I think it will move quite quickly. On the mandation of health staff, I will support that to be consistent with the mandation of vaccines in the care sector. I just think if you work in the health service, working with vulnerable people, you have to believe in science, surely, above all else. And there is, of course, precedent because of hepatitis B. So it's a mixed egg for me, mixed batch for me. I'll support some of the measures before us today. I won't support others. Thank you.